other presenter is Dr. Vladimir Sanchez. Am I right? He will be presenting on 5 years follow-up of patients with facial basal cell carcinoma treated with combination of interferon alpha, 2 beta, and gamma. Doctor is from University of Medical Sciences of Santiago de Cuba. Yeah. Dr. Vladimir, are you there with us?
Hello.
Yes, doctor, welcome.
Thank you very much.
Yes, doctor, over to you. The floor is yours.
Okay. Good afternoon. I'm Vladimir Sanchez Linares. I live in Sancti Spiritus, or not Santiago, Sancti Spiritus, Cuba. I'm dermatology. I'm going to present the World 5-year follow-up of patients with facial basal cell carcinoma treated with a combination of interferon alpha 2b and gamma. One moment, please. Okay, 5-year follow-up of patients with facial basal cell carcinoma treated with a combination of interferon alpha 2b and gamma. Basal cell carcinoma is the most frequent malignant skin tumor, and the incidence of BCC is increasing worldwide. And do you listen?
Yes, doctor, you are audible.
Okay,
yes,
okay.
yes.
Okay, sorry. Basal cell carcinoma is the most frequently malignant skin tumor, and the incidence of BCC is increased worldwide, and those who have the condition are at a high risk of developing future BCC. Although the relative mortality is low, BCC may cause considerable morbidity, particularly in visible areas such as the face, with consequent unacceptable cosmetic outcome and adult functional impairment. Many therapy modalities to treat basal cell carcinoma, but the surgery is the gold standard to remove the tumor, and no surgical treatment, for example, 5-fluorouracil cream, imaging mode, cryosurgery, curettage, and electrodesiccation, radiotherapy, bismuth, photodynamic therapy, and interferon. But the first thing is to classify in difficult to treat or easy to treat. For example, this is a British Association of Dermatology guidelines for the management of adults with basal cell carcinoma. And this to classify the BCC in low risk and high risk. The Genetic Engineer and Biotechnology Center in Havana, Cuba, developed a new formulation of interferon alpha 2b and gamma called interferon for treatment of BCC and any size, subtype, and location. Interferon is a pharmaceutical formulation, proprietary, anti-proliferative, anti-angiogenic, and immunomodulatory. The objective was to describe the evolution of patients with facial basal cell carcinoma treated with a combination of interferon alpha 2b and gamma after 5-year follow-up. This combination, interferon alpha 2b and gamma, is the interferon. Design a prospective descriptive case series, sharing primary healthcare centers in the real-world medical practice and time for patient requirement for June 10, 2015 to February 20, 2018. Follow-up of my period 5 years. The population adult with histological confirmed facial BCC not suitable for decline surgical treatment. An intervention perilesional administration injection of 10.5 million in international unit of interferon 3 times a week for 3 weeks. The outcome, three outcome effectives and 1 safety, clinical response, recurrence, second primary BCC, and adverse event. The classified results, we adopted treatment response category based on recommendation of the response evaluation criteria in solid tumor group. For example, complete response, total tumor, disappear, partial response greater than 30% decrease in sum of diameters, stable disease influence, insufficient decrease to qualify of partial response or insufficient increase to qualify as progressive disease. And then this is the baseline characteristic patient: age, male, skin type, lesion site. And here, the localization of the tumor, most of the lesions were localized in the high risk area, 74.7%. This is the different clinical subtype, and the user was most frequently. Now, the outcome, the clinical response, complete response in 74.6%. Complete response, which is the disappear the tumor. Partial response, 51 patients, and stable disease, 2 patients. The consideration, the objective response included complete response and partial response, 99 patients. And the partial response and stable disease were treated with surgical excision, and together with complete responder were followed for 5 years. This is a survival analysis Kaplan-Meier for recurrence. The follow-up period was 5 years. And so you can see here the mean for development of recurrence was 55 months, and the probability of the being tumor-free at 5 years was 88.4% at 5 years follow. And this is a survival analysis, Kaplan-Meier 2, but for development second primary BCC at 5 years. So you can see here the mean of development of second primary BCC was 52 months. And sorry. And at 5 years, follows 79.2% has been free second primary BCC. This is a survival analysis, the probability development basal cell carcinoma. And this is a list of the frequency of adverse events. They were frequent, you can see here: fever, injection site pain, headache, antalgia. And you can see here the intensity or adverse events. The adverse event is most frequently, but no serious. Okay. Now I'm going to show you some graphical evidence. In this patient, after treatment with interferon primary BCC, this is a sample of recurrence. The patient has BCC infiltrate. An evaluation after the treatment and develop a recurrence at 4 years. In this case, the patient had basal carcinoma. In this area, you can see here an evaluation after the treatment at 5 years. And this patient with BCC solid in difficult area to treat in the nose. You can see in different angle an evaluation after the treatment and 5 years. The conclusion, perilesional administration of interferon is a viable therapeutic alternative for patients with facial BCC not for surgical treatment with outcomes such as like other non-surgical therapeutic and safety profiles are I think interferon. I think the interferon may be option for difficult to treat BCC. Thank you very much.